Good morning, everyone. Thank you for joining me. Allow me to introduce myself. My name is Georgie Gould. I'm the Project Coordinator at Global Community Resourcing. I'm pleased to be the moderator of today's webinar, the focus of which is enhancing community care through equal access to assistive technology. Our webinar today is facilitated by Global Community Resourcing for the Community Care Smart Assistive Technology Collaborative. Global Community Resourcing has extensive international linkages, and we've been fortunate enough to work with many international projects and research entities. If you've joined us for previous webinars, you'll know that they are designed from feedback and requests we receive through the collaborative. The focus of our webinars is to bring together local, national and international perspectives in research and development, as well as the deployment of smart assistive technology in the community care sector. Just a reminder that if you haven't registered for the collaborative site, it is accessible to all and free to register at www.satcommunity.com.au. Please note that Global Community Resourcing are not promoting or endorsing any particular product, research entity or organisation. The purpose of our webinar is to serve and to inform viewers of various smart assistive technology currently in development and or deployment. We welcome questions, but I will let you know that all microphones have been muted. This is in the interest of the recording. Your questions can be added to the question panel on the dashboard on the right of your screen. There will be an opportunity for your questions to be answered at the end of the session. At previous webinars, we have been inundated with questions, so the earlier you post your questions, the more questions we can respond to. In this webinar, Lauren will explore the impacts of ensuring equal access to assistive technology within the community care sector. Lauren works in the role of Policy Officer at the Council of Ageing in Victoria, where she coordinates the Assistive Technology for All campaign, a national campaign that is advocating for equal access to assistive technology for people with a disability who are excluded from the National Insurance Scheme. Lauren also sits on the board of the Australian Rehabilitation and Assistive Technology Association. As a person who is blind, Lauren is also an assistive technology advocate, but also keen assistive technology user. Welcome to the Community Care Smart Assistive Technology Collaborative, Lauren. Take it away.
Thanks so much, Georgie. So I really just wanted to thank you for inviting me to come and speak on this topic today. Assistive technology is a topic that's very, very close to my heart because I'm totally blind, as Georgie said, and I use a range of assistive technologies to help me live, work and play. Right now, I'm actually delivering this presentation using text-to-speech software on my iPhone. And my presentation today is really going to focus on the assistive technology funding gap that currently exists for many people with disability and how that gap can be addressed. I'm going to get into the ins and outs of the campaign I'm coordinating in this area a little later in the presentation. For now, though, I really wanted to focus on why a campaign is actually needed. I need to preface this by stating that the definition of assistive technology that I'm working with is very broad. So we're basically talking about any aid, piece of equipment or home modification that can help someone overcome the impact of disability or aging, such as grab rails and ramps, prosthetic devices, mobility aids like wheelchairs and scooters, and specialized computer software and hardware, and much, much more. I understand that this group is particularly interested in smart technologies such as movement sensors, alarms, automated health monitoring devices, software, mobile phone applications, and network connected devices. And the issues relating to funding that I'll be covering in my presentation are just as relevant to these assistive solutions. Because if we can't fund smart assistive technologies, then they won't be effective in helping the people that most need them. Now, I'm probably preaching to the choir here, but we know that access to assistive technology is an issue that affects a sizable part of the Australian population. 20% of Australians have a disability or long-term health condition that may affect their ability to perform everyday tasks. And we know that the prevalence of disability increases with age. In fact, almost 50% of Australians over the age of 60 have a disability. Disability is also the only minority group that any of us can join at any time, and I'm living proof of this. I lived the first 20 years of my life without a disability, and then a car accident changed my life forever. And that's not an experience that's unique to me. There's hundreds of thousands of Australians who are experiencing these major life changes every single day. So I don't think I need to explain the importance of assistive technology to the people in this group, because you'll all be aware of the benefits. So things like, just very briefly, it can delay entry to residential care. It can reduce accidents and falls, and therefore GP admissions, hospital visits. It can reduce the burden on families and carers, increase independence. It's a very, very, very broad list of benefits that come from providing people with access to assistive technology when they need it. I also don't think I really need to go into the ins and outs of the National Disability Insurance Scheme, because everyone's going to be familiar with the NDIS. The main point I'd like to make in relation to the NDIS, though, is that it's able to fully fund the assistive technology that's needed by people with disability, meaning that the technology comes at no expense to the individual. The NDIS is also underpinned by an assistive technology strategy. And there's also a new participant guarantee in place to try and ensure that people get the assistive technology they need in a timely manner. Unfortunately, not everyone with disability can access the NDIS though, and I'm sure that this is an issue that a lot of you are already familiar with. So who's missing out on the NDIS? Well, a lot of people actually. While the NDIS is often framed as the be-all and end-all solution to providing support to people with disability, it was only ever projected to support about 10% of people with disability across Australia, which means the other 90% are missing out. Fun fact, you have to be under the age of 65 to start accessing services under the NDIS. That's written into the NDIS Act and the NDIS rules, and that means that older people with disability are the largest group of people to miss out on receiving support under the scheme. So just to be clear, if you acquire a disability after you turn 65, you miss out. If you have a chronic or progressive condition which hasn't required you to access disability supports until after your 65th birthday, you miss out. And if you acquired a disability before you turn 65, but you happen to be over 65 when the NDIS was introduced in your area, you also miss out. This last one is hugely inequitable. We speak to a lot of people who have lived with disability for their entire lives, but they've missed out on the NDIS by a matter of days, weeks, or months because of their age. It's important to remember that this issue doesn't exclusively affect older people though. An estimated 800,000 people with disability under the age of 65 may also be excluded from the NDIS because they don't meet the other eligibility requirements for the scheme. I'd like to just pause at this point and see, I'll take one question if anyone has one, otherwise I'm to press on. Georgie, do we have any questions?
Not at this time, Lauren.
Yep, all right, great. So the fact that a lot of people with disability are currently excluded from the NDIS isn't actually the problem, because at the end of the day, people aren't really too concerned with where their support comes from as long as they're getting it. Right now, though, people who are excluded from the NDIS are not getting the support they need, and they can't access assistive technology on an equitable basis with participants of the NDIS. Funding for assistive technology for people who are excluded from the NDIS is currently spread across more than 65 different funding streams at the state and Commonwealth level. This complex maze of funding is confusing and difficult for consumers to navigate. There's also no consistency in how assistive technology is provided to people outside the NDIS. The amount of funding an individual receives can vary greatly depending on their age, where they live, and where and how their disability was acquired. There are also inconsistencies in the types of assistive technology that can be funded. The sort of solutions that are funded under the Queensland Medical Aid Subsidy Scheme, for example, will differ from those that are funded under any of the other state-based aids and equipment programs. And the critical issue is that there's simply not enough funding available to meet the demand for assistive technology that exists outside the NDIS. This means that people with disability who are excluded from the NDIS are frequently forced to wait more than 12 months to receive the support they need, to part or fully fund their assistive technology themselves, or to go without the assistive technology they need altogether. As an example, let's have a look at the experiences of two men named Robert and Steve. Robert and Steve have both had their lower legs amputated due to aggressive infections. And while they both have the exact same impairment, they receive different levels of support. We'll look at Steve first. So Steve is in his late 50s and he's a participant of the NDIS. His first plan enabled him to trial a variety of prosthetic devices to determine which would best meet his needs. And as a result, he was able to receive funding for an advanced computerized microprocessor knee unit and prosthetic foot. He was also able to have modifications to his home funded, including grab rails in his bathroom and toilet and a ramp at the rear of his home. The support Steve has received under the NDIS means he's no longer at risk of falls. He's also been able to return to full-time work and enjoys an active lifestyle with his wife and two children. So that's Steve. Let's compare Steve's experience. So Robert's in his late 60s and he doesn't meet the age eligibility requirements for the National Disability Insurance Scheme. He receives support under a state-based artificial limb scheme, which doesn't allow him to have choice and control over the prosthetic devices that would best meet his needs. Robert has only been able to access funding for a very basic mechanical knee unit, which results in him experiencing regular falls. His prosthetic foot is also very basic and causes regular fatigue. Robert will often use a wheelchair for mobility if he's feeling fatigued or has had a fall. Right now, though, he only has access to a very basic wheelchair that is heavy and hard for him to push around. He'd like to have grip bars installed in his bathroom and toilet to reduce his risk of falls at home, but he can't access funding to make these modifications and he can't afford to pay for them himself. Until recently, Robert worked full-time. He's now been forced to reduce his work hours due to his ongoing risk of falls. Going out without the support he needs continues to compromise Robert's health, safety, and overall quality of life. Okay, so that's just a quick comparison of what we're dealing with when we look at the support that's available to someone under the NDIS and someone who falls outside of it. And look, I'm the first to acknowledge that the NDIS is by no means perfect in this area. We know that there's a long way to go, but I guess the bottom line here is that the NDIS does present a nationally consistent framework for funding assistive technology. It says that people have access, they should have access to fully funded assistive technology, that they can access reasonable and necessary assistive technology. And these are the sorts of things that just don't exist for people outside of the NDIS framework. So I'll pause again just here and see if there's any questions before moving on. Georgie, do we have any questions?
We do have one question from Scott, who's been on the waiting list for some time for some much needed assistive technology and thinks it's unacceptable. Just wants to know what's happening to improve this, if you know this at all.
Sure. So it's difficult to know without knowing, are you on the waiting list for a state-based scheme or a home care package under the aged care system? Are we able to get that information?
I will go back to him and ask him.
Yep.
Georgie, I was just talking to Scott in the background. Lauren, he is waiting on a home care package.
Yeah, okay. So aged care system, hugely complicated, hugely problematic, and waiting lists, people are waiting upwards of 18 months to get a home care package because while the NDIS is basically, it's based on the premise that if you need support, you will get it. You will get a funding package. With the aged care system, though, there's only a finite number of funding packages available. So the waiting list is literally based on the fact that you are waiting for someone else to die for their package to become available. There's only a certain amount of packages available at any one time. Now, for the last 2.5 years, there's been a Royal Commission into aged care quality and safety happening, and that Royal Commission has concluded. So the final recommendations from the Royal Commission were handed down to the government last month. The government is yet to provide their response to those recommendations, but they firmly state that people should not have to wait any longer than 30 days to receive a home care package, and it's unacceptable that they're waiting the length of time that they're waiting now. So certainly the things that we're advocating on at Council on the Aging, where I work, is for that to be implemented as a matter of urgency, for that waiting list to be cleared, to make sure that people get the support when they need it. Because if they don't, we see people have a further deterioration in health. We see people die while they're still on waiting lists for home care packages, which is just outrageous in a country as wealthy as Australia. And we see people having to move into residential care because they just don't have any other option. So there are things happening in this space. And later on, I'll be telling you what you can do to get involved and help advocate for change, but certainly acknowledge that it's a very frustrating experience. It's unacceptable. And my heart is with you. I really feel for you because it's not fair that you should have to wait that long.
Thanks, Lauren. There are a couple of questions around the Royal Commission, but I think I'll ask them towards the end of the webinar. We'll wait to have a discussion further on that. Thanks, Lauren.
Okay, sure. So I'll move on then. And the previous example I gave involving Robin and Steve, that demonstrated the inequity in the provision of assistive technology itself. But of course, simply providing assistive technology is often not enough. In a lot of cases, people will also need specialised training to help them get the most out of their assistive technology. And outside the NDIS, it can't always be funded. I'll tell you about one particular example involving a woman named Laura. So Laura is 70 years old and she has retinitis pigmentosa. It's a condition that causes progressive vision loss. Up until recently, Laura had quite good usable vision, but over the past 12 months, her main vision has deteriorated to the point where she can no longer read print. Because she can't use screen magnification software anymore to access digital services, Laura wants to learn how to navigate her computer and iPad using specialized text-to-speech software. She wants to learn how to send and receive emails, navigate the internet, and create and edit documents using this software. Because she's completely unfamiliar with it though, it might take quite a few hours of training to enable her to meet these goals. A blindness service provider has quoted Laura $180 per hour to provide the training she needs, and this aligns with the NDIS price guide. As a recipient of a level 2 home care package under the aged care system though, she's unable to afford this training because it would force her to go without other vital forms of support she needs. This training is also unable to be funded under her state-based aids and equipment program, so she simply has to go without and she can't access the digital services she needs to. At the Council on the Aging, we encounter these sorts of barriers all the time. There's so many older people who have dexterity issues because of arthritis, vision problems, or other functional limitations that might make it difficult for them to access a standard digital device. But there's no funding available for assistive solutions that can fill those gaps or training to enable people to use those assistive solutions competently and independently. Any questions at this point, Georgie?
No questions, Lauren.
Yep. So we're starting to get a sense of the level of inequity that exists between those who are eligible for the NDIS and those who sit outside it. And I just want to remind everyone that this is a human rights issue. There are a range of international human rights treaties that the Australian government has signed and has agreed to uphold. And one of these is the Convention on the Rights of Persons with Disabilities. The convention says that governments need to make sure that people with disability have the support they need to be included in the community and prevent them from being isolated. It also says that governments need to make sure people with disability have access to affordable assistive technology to enable them to be as independent as possible. Put simply, access to assistive technology is a fundamental human right, and governments don't get to cherry pick which people with disability can access it. It's a right that belongs to all people with disability equally, and it's a right that needs to be upheld. And this is where the Assistive Technology for All campaign comes in. The Assistive Technology for All campaign, which is the campaign I'm leading in my role at Council on the Aging, is being driven by a national partnership of peak bodies and consumer representatives spanning the health, ageing and disability sectors. We've joined forces to advocate for the establishment of a harmonised and nationally consistent assistive technology program to meet the needs of people with disability who are excluded from the NDIS. The members of our alliance and the consumers we represent believe that the lack of equity in Australia's disability support system is unjust and intolerable. And that's why we've launched a public campaign to bring about equal access to assistive technology in Australia. Importantly, the assistive technology program that we're calling for must be aligned with the NDIS assistive technology strategy to ensure equity in the provision of assistive technology to all people with disability who need it. The government already knows what needs to be done and how to do it. It's all laid out in the final report from the Review of Assistive Technology Programs in Australia, which was published in July last year. The need for urgent action has also been reinforced through the recommendations from the Royal Commission into Aged Care Quality and Safety, which, as I said, were handed down last month in March. Australians with disability can't wait any longer. Time for changes now. So moving on to how you can actually get involved and help. Assistive Technology for All is a grassroots campaign. We need to remember that the reason we're in the position we're in right now is because our government continues to focus exclusively on the NDIS as the solution to supporting all people with disability. And in doing so, they've neglected and continue to neglect the 90% of people with disability across Australia who will never be eligible for this scheme. We need to let them know that this is no longer acceptable, that all people with disability have a right to access assistive technology when they need it, not just those who are eligible for the NDIS. And we need to make sure that this issue gets on the government's radar and stays there until it's been resolved. There are a few things that people can do to get behind our campaign and help us achieve assistive technology for all. So the first thing people can do is visit our campaign website at www.assistivetechforall.com.au and sign our e-petition asking Minister for Families and Social Services, Anne Ruston, to ensure a national assistive technology program is funded under the new National Disability Strategy, which will come into effect later this year. If you know someone who's been directly affected by the issues we're trying to address, and I noted that the previous question came from someone who's been on a waiting list for quite some time. So if you know someone who's affected by the issue or you're affected yourself, we'd really love to hear those stories. It's really, really important that we build up a case study of, a log of stories, a library of stories, because personal stories have the most impact when we're working with government and they can really help us advocate for change. So we need to collect as many of them as possible. And finally, the last thing you can do is spread the word about the campaign and encourage others to get involved. We need to speak out loudly, and the more voices that join our choir, the stronger we will be. We'll be starting to really ramp up our activities around the campaign quite significantly over the coming months. So I'd really encourage people to keep an eye on our campaign website, to join our mailing list, which you can do via the website, or you can also join our closed Facebook group to keep up to date on what's happening. The Facebook group, if you just go into Facebook and under the search feature, just type in Assistive Technology for All, it should come up, and I can let you into that group today if you request access. So that's a good and easy way to keep in touch and discuss some of these issues. I wanted to keep the presentation relatively short because I know that when I do these presentations, there's usually a lot of questions and a lot of discussions. So I'll leave it there, and Georgie, happy to take any questions people have.
Thanks, Lauren, and thank you for your presentation. All the links that you've just mentioned will be available on the collaborative website after the webinar today.
Great.
We do have a couple of questions around the Royal Commission. I guess it's a hot topic right now. So one question's come in noting that we are concentrating on NDIS. However, in the recommendation of the Royal Commission of Aged Care, recommendation 34, the Assistive Technology and Home Modification calls for the federal government to introduce a grant fund scheme for assistive technology and home modification by July 2022. Do you believe this is achievable?
Big question. I don't work in government, so it's hard to say, but I believe so. So the reason why I'm calling for a national program is because a lot of the funding already exists, right? So we've got 65 different programs that already exist at the state and Commonwealth level. All we need to do is pull them together. A lot of the funding is there. We might need to add to it a little bit, but a lot of the funding is already there, and they already have the roadmap of how to do this. As I said, there was a review of assistive technology programs in Australia that was conducted late 2019, 2020. That report is available publicly, and the government commissioned that review because they wanted to know where the gaps were and how they could be addressed. So they are looking at this. I think it is achievable. I think It might not be fully functional by the timeline that they've specified there, but I think they can actually establish it by then. I do think it's achievable, and I think we need to assume that it is.
And another question around the Royal Commission. Do you think that the Royal Commission into Aged Care, Quality and Safety and the Royal Commission into Violence, Abuse, Neglect of People with Disability have highlighted the need for broader use of assistive technology in Australia?
Good question. I think the Aged Care Royal Commission, definitely, it's been well highlighted, and there's quite a number of recommendations that came out of the Royal Commission that refer to assistive technology. And what was really highlighted in the final report from the Aged Care Royal Commission was that we need to be doing more to help people remain in their own homes for as long as possible. People don't want to be forced to move into residential care, and it should be their choice where they live and where they age and eventually die. It shouldn't be that they are forced to do these things in residential aged care if they don't want to. And assistive technology is one of the key enablers that can help people remain in their own homes for as long as possible. So I certainly think that that's been highlighted through the Aged Care Royal Commission. With the Disability Royal Commission, I did trawl through the interim report. There was like one sentence, I think, that really highlighted, yes, assistive technology is a key enabler in making sure that people can participate in community activities and really be included in the community, but it wasn't highlighted as well as I would liked it to have been. So speaking to that, given the Disability Royal Commission has not yet concluded, if anyone feels passionately about this, I would encourage you to make your own submission to the Disability Royal Commission. It doesn't need to be long or fancy. It can be just in the format of a letter, a few bullet points. You can even call them up and they can help you write your submission over the phone. And the Assistive Technology for All Alliance, we've been doing some policy work as well. So we made 2 submissions to the Aged Care Royal Commission. We've already made 1 to the Disability Royal Commission, and we're in the process of putting another one together at the moment, and that's specifically responding to the issues paper they've published around inclusion. So we are trying our best to make sure that it's highlighted through the Disability Royal Commission as well, because one of the things we know is that people are more vulnerable to experiences of violence, abuse, and neglect when they have a forced dependency on others. They're forced to rely on other people, and not providing people with the assistive technology they need, it forces them to rely on other people. So it's a gap that needs to be addressed, and hopefully will be highlighted in the final report and recommendations from the Disability Royal Commission.
Definitely, and we will include all those links in the follow-up article about this webinar on the Community Care Smart Assistive Technology Collaborative, and looking forward to seeing the government's response to the Royal Commission in late May.
Yeah.
We do have time for one more question. Someone's just sent through asking how your campaign is getting traction.
Yeah, it's got a lot of traction with organisations in the health, ageing and disability spaces at the moment. The alliance that backs the campaign, there's about 26 different organisations across Australia that support that. And we're talking about organisations like People with Disabilities Australia, Australian Federation of Disability Organisations. So certainly the support is there. The next step is we're working on some activities at the moment to really help roll out the message to people at the grassroots, people who are affected by this issue, friends, family members, carers. In terms of government, I think we're slowly getting there. So certainly some of the recommendations that we saw in the Aged Care Royal Commission, we would never claim full responsibility for those, but certainly we think the advocacy work we did around the Aged Care Royal Commission has made a big difference, because for a long time there was absolutely no acknowledgement of the fact that people outside the NDIS were getting a raw deal, and particularly over 65s. But we now have a couple of recommendations in the final report from the Aged Care Royal Commission that say people with disability, no matter where they're receiving their support, if it's through the aged care system, should have the same access to what younger people have access to under the NDIS. So that's now clearly been recognised, and that I think is a real achievement. So what we're focusing on now is the National Disability Strategy. I don't know if people are familiar with the National Disability Strategy, but it's basically a 10-year blueprint for outlining what Australian governments will do to implement Australia's obligations under the Convention on the Rights of Persons with Disabilities. The last strategy expired last year, and the new one is going to be rolled out in the second half of this year. It will cover 2020 to 2030. And so we're really focusing on making sure that this issue is acknowledged and ultimately addressed under the new National Disability Strategy. So as to whether it's gaining traction, I think the proof will be in the pudding when we see the final version of that National Disability Strategy. And hopefully it will acknowledge and address these issues once and for all.
Well, thank you, Lauren, for your fantastic work and for your presentation today. Look forward to sharing on our collaborative. And if there's any follow-up questions, I'll send them through and we'll post them on the collaborative as well. So what's next for the Community Care Smart Assistive Technology Collaborative? Well, our next webinar will be with Ferris Care, focusing on their smart home project on the 12th of May at 10 o'clock. So if you haven't already registered, please visit www.satcommunity.com.au. And if you haven't formally registered for the collaborative, you can also go to that website and access the collaborative and all the resources for free today. Please check the collaborative for more information on upcoming events. And if you have any further questions or inquiries, please email us at sat@communityresourcing.com.au. Once again, I'd like to thank the members of the collaborative research team and today's guest speaker, Lauren. Thank you everyone for attending today's session. Hope you have a good day.